Reimagining Rural Health, a podcast series brought to you by Sanford Health. In this series, we explore the challenges facing healthcare systems across the country, from improving access to equitable care, building a sustainable workforce, and discovering innovative ways to deliver high-quality, low-cost services in rural and underserved populations. Each episode examines how Sanford Health and other health systems are advancing care for the unique communities they serve. In this episode, Courtney Collen with Sanford Health News talks with Ford Koles, national spokesperson with the advisory board, for a conversation on the state of today's healthcare economy.
I have Ford Koles joining me now. Thank you so much for your time. Welcome to Sioux Falls.
Thanks, Courtney. Good to be here.
You are a health economist by training. You're well-versed in healthcare history and the many reform initiatives we have been through over the past few decades. Ford, what do leaders need to know today to shape the future of healthcare beyond 2024?
Courtney, I think the most fundamental truth is that we built a healthcare system in the United States with the assumption of commercial reimbursement. Right. When I was in econ school and you wanted to understand how much commercial payers paid for a surgery, we would plug in 120% of Medicare. Not on the medical side, on the surgical side. That number now, according to Rand Corporation, is 2.7 times higher. It was 20% higher. Now it's 2.7 times higher, meaning the cross-subsidy model is under immense strain to keep up with growing government payment. So more and more of our future is Medicare and Medicaid, and that's a fundamental challenge to the cost structure we built in America. We have to change it.
What do you see as the industry's most urgent challenges and greatest opportunities?
Wow. So many amazing things going on in this industry, as always. I think that the need to remake costs, per my last point, there are three things we spend most of our money on. Labor, which was an unholy mess in COVID, and we're just getting it back, to a place of maybe not sustainability, but calm. Supplies and purchase services, where we were making immense progress before COVID, by the way. Unifying the spend under different vendors, getting better long-term relationships. All of that went out the window with COVID because of the collapse of the supply chain. And lastly, capital spending, which, as you know, Courtney, is IT and buildings, right? Yep. So we need a lot of progression. There's not much on the labor front right now. We're reinventing the social contract, hopefully using artificial intelligence. So I think there are long-term savings there and good things. But most of the progress we're making right now has to be in the supply chain.
You talk about an increasingly tough business climate dominated by those increasing costs and prices, tightening margins, and other headwinds. Ford, how will these disruptive market forces affect decision-making and outcomes for patients?
We went through a phase, if you look at, the patients themselves, and the numbers are bad. The quality numbers held, Courtney, really strong for the first few years of COVID in a way that I think people don't talk about enough. We held it together in an unbelievably ugly time for healthcare, and the quality numbers stayed pretty strong. In the last year, they've really started to drop, and I think what you're looking at is not some long-term crisis. I think it's exhaustion, frankly. It's like somebody holds it together in a tough situation in their life for a few years, and then when things finally improve, they kind of fall apart. I think that's sort of what's happened. So I'm not as worried about it long term for the health of America. Lifespan has stopped improving, but those are COVID deaths. And I don't, and that's not the fault of the healthcare system.
Right.
Americans tend to blame the healthcare system for things that are largely lifestyle related issues.
How do these challenges and opportunities play out for nonprofit healthcare systems in particular?
Yeah. The truth is, it's still, to me, a wonderful model. It's a mission-driven model. Yeah. We need a workforce. This workforce keeps telling us, the people coming out of school, that they want purpose and they want motivation. What's more purposeful and motivating than the mission of most not-for-profit hospitals and health systems and providers, right? So I think we have some natural advantages there, right? Not-for-profits tend to be far better at physician integration. The for-profits generally don't do much of that. That's not their history. That's not been their business model. That's not a criticism. It's just a difference between not-for-profits and for-profits. But I think so much of what happens in healthcare is local and has to do with our relationship with the medical staff. I like Sanford as a regional player. I like what they do. Mm-hmm. They have rural challenges, that are far more aggressive than a lot of the urban systems I work with. But I like the relationship they have with the medical staff.
You spoke here in Sioux Falls, South Dakota, to a number of Sanford's top leaders. What was your one key takeaway, or golden nugget, as I like to say, that we can take home?
Relatively speaking, American healthcare is in better shape, way better shape than a year or two ago. Mm-hmm. Sanford's in much better shape than most. Mm-hmm. So I guess I'd want them to take the win in that sense. Sanford's numbers are better than most numbers. The biggest issues that I hear about at Sanford are largely workforce issues that have to do not with Sanford but with South Dakota. Mm-hmm. They have to do with population growth or lack of it. They have to do with the cost of living increases that have been huge between Sioux Falls and Omaha. So I think that there are challenges here, but they're not challenges. They're not the challenges, I think, of a poorly run healthcare system. Let me put it that way. I like the leaders here impress me.
Good to hear. What excites you the most about the future of healthcare?
I said it in my talk, which is we are on the cusp of some major advances, both in treating obesity and in treating Alzheimer's. Both of those things are present in my family. And I would typify them as the two great healthcare challenges of our lifetimes. And the fact that we're making significant progress in both of them, to me, is miraculous and wonderful. And they come with all kinds of reimbursement and spending challenges, but I refuse to look them in the face as something bad. I think that I think we're seeing amazing progress here.
Ford Koles, I really appreciate your time. Your insight is so valuable, and we thank you for being here and for joining us for this podcast.
My pleasure, Courtney. Thank you.
You've been listening to Reimagining Rural Health, a podcast series brought to you by Sanford Health. Hear more episodes in this series or other Sanford Health series on Apple, Spotify, and news.sanfordhealth.org.